My name is Dr. Mohammed Rafique. I am working as a consultant trauma and orthopedic surgeon here in Aga Khan Hospital, Kisumu. Today we are going to share a story of a gentleman, 44-year-old Mr. Francis. He presented in my clinic with a complaint of pain and reduced range of motion over the left elbow joint. X-ray was in his hand, which was normal. Examination was a bit suspicious about the rupture of distal tendon of the biceps, and then he has been advised to get an MRI done for the confirmation purpose. It was a full defect tear of the distal biceps tendon. So after counseling and discussing multiple management options, we have obtained a surgical option for better outcome and proper rehabilitation and early rehabilitation purpose. Then we have done endo button technique. We gave a small incision over the anterior aspect of the left elbow, where should be the insertion of the biceps tendon. We debrided, and through the endo button technique, we have secured the distal part of the biceps tendon over its insertion site. Now the patient will share his experience with this surgery.
I'm Francis Anditi, a resident of Kisumu. About 2 months ago, while at home, I was just doing the daily duties back in the compound. I was lifting some wooden shutters. I was moving from one place to another. Then as I was lifting one of them, I just felt a snap on my left arm, the elbow. I initially ignored it. I thought maybe this is just a small problem that would just go on its own. But with the time, the pain started, and then it became difficult lifting the arm. My first step was to come to the hospital, and an X-ray was done. So when the X-ray showed there was nothing, all the bones were intact, the elbow joint was okay. But when I went back home 1 week later, lifting my left arm became much more difficult. It started swelling, the pain, rotating the arm itself was difficult. Then I sought the opinion of a surgeon. I came to see Dr. Rafique, with whom we discussed. He proposed that I do an MRI. We discovered that there was a tear in the biceps tendon. And thereafter we discussed with him and said this can be repaired surgically to help the elbow come back into its functions. The surgery was done. Up to date, I can say the recovery is ongoing well. Now able to lift the elbow without much pain that I was feeling on the inside part of the arm, and even freely rotate the arm without the pain. I can say this is a successful surgery.